Australia's two most populous states have reintroduced COVID-19 curbs in the face of mounting infections. Daily cases have crossed 8,200 to hit a fresh high. Mask wearing will be mandatory indoors across New South Wales and Victoria from tomorrow. Capacity limits and QR code check-ins are also being brought back. These rules were only just removed earlier this month.
We are encouraging people, particularly over the holiday period, if you can work from home, please work from home. We do want to limit mobility just as we get through this period of time, and particularly in relation to ensuring that our health workers are able to be on the job and provide that care and support for those who are unwell.
Omicron is driving the growing outbreak in New South Wales. It accounts for around 80% of cases in the state. Initial data shows the risk of hospitalization is around 60 to 80% less than for Delta. And Daniel Robertson explains why authorities have reversed their decision despite insisting they will not return to strict restrictions.
It's really the soaring number of cases that has prompted millions of Australians to be thrust back into COVID restrictions again tonight as state leaders try to stay in control of the Omicron variant. We are seeing these restrictions being reinstated, particularly in New South Wales, where they have seen a record number of cases, more than 5,700 COVID-19 cases. Now, that is the highest number of daily COVID-19 infections in all of Australia. So that has really prompted this reintroduction of the mask mandate and QR codes. Now, hospitalisations have also increased. There's more than 340 people in hospital and around 45 in ICU. Now, while hospitals say they aren't overwhelmed, they are coping at the moment. And while there are suggestions that the Omicron variant, there's less of a risk in terms of hospitalisations, there's still that concern there. And there is still really, the state is on high alert. Considering the high number of cases, usually what follows is a high number of hospitalisations, and we're really trying to prevent that. This is also trying to ease pressure on the healthcare system that itself has been decimated by COVID-19. In terms of hospital staff, more than 1,500 are unable to work because they're sick, unwell, in isolation, or have tested positive themselves.